Welcome to the Center for Advanced Studies in Child Welfare. This module is entitled Health Literacy as a Social Determinant of Health in Asian American Immigrants. My name is Houa Vang, and I will be your narrator during the module. I am a research assistant for Dr. Hee-Young Lee at the University of Minnesota's School of Social Work. Dr. Lee is a professor and director of research. Her major research areas are cancer health disparity, cancer and health literacy, and family violence among underserved minority populations, with particular attention paid to immigrants and refugees. To begin, in this learning module, we would like to share some background information on health literacy. Health literacy has recently emerged as an important social determinant of health outcomes as a result of its significant association with physical and mental health disparity. According to Ratzan and Parker, health literacy refers to the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. 1 in 2 adults do not have the skills necessary to obtain or understand information about their health and health decisions. Having low health literacy affects people's ability to navigate the medical/insurance systems and to manage health problems, contributing to health disparities. Currently, little is known about the determinants of health literacy, particularly among minority groups. So why is health literacy important? Health literacy is important because it impacts timely access to and use of existing health services. This is related to limited awareness of health symptoms, lack of knowledge of where to seek services, limited ability in identifying illnesses, and decreased health service utilization. Research on health literacy determinants have focused on only some predisposing factors such as gender and ethnicity/race, in which minority immigrants have reported low health literacy. Some research have focused on enabling factors like education and income, which also shows having low levels of education and income are associated with low health literacy. And need factors researchers have looked at includes self-rated health status, depression, and a number of chronic diseases. High health accessibility is associated with high health literacy. Several studies have left out key factors related to health literacy when exploring determinants of health literacy, such as previous research or previous experience with health system or healthcare utilization. Only few studies have modeled the collective impact of these factors on health literacy. Immigrant populations are among the most vulnerable to health disparities in the U.S. For immigrants, health literacy is closely associated with English proficiency and cultural beliefs. Inadequate health literacy contributes to poorer health status. Also, a lower health literacy level is closely related to more depressive symptoms. The role of health literacy on health outcomes among immigrant populations has been understudied. Studies that do exist typically focus on a single immigrant population group with a single outcome variable. Little is known about different levels of health literacy among distinct ethnic groups of Asian immigrants. This study has two objectives. The first is identify the levels of health literacy among 5 subgroups of Asian immigrants and compare these to the aggregated Asian immigrant group and non-Latino whites. The second objective is identify the association between health literacy and 2 health outcomes. The first, self-rated health status, and the second, depressive symptoms, across the 5 subgroups. These subgroups include Chinese, Korean, Filipino, South Asian, and Vietnamese. The study also has 2 hypotheses. The first hypothesis is the aggregated Asian immigrant group will have a lower level of health literacy than its non-Latino white counterpart. The heterogeneity among subgroups of Asian immigrants would lead to varying levels of health literacy. The second hypothesis is Asian immigrants with a higher level of health literacy will have a higher level of self-rated health status and a lower level of depressive symptoms than non-Latino whites. The present study used data from the 2007 California Health Interview Survey, also known as CHIS, which surveyed California residents on their health and well-being. The CHIS is a biennial telephone survey of the non-institutionalized population residing in California, where data was collected from households that had at least one parent and one minor child. It is administered in 5 languages: English, Spanish, Chinese Mandarin and Cantonese, Korean and Vietnamese, and it oversamples Asian Americans. The 2007 survey was selected due to the presence of health literacy items that were included only in the 2007 survey. The same literacy items were used as and demonstrated to be a suitable proxy for health literacy in a previous study. Although CHIS 2007 dataset and health literacy information has been explored in he and colleagues study, the present study differs in that its participants' demographics extend beyond only Asian immigrants. The breadth of the determinants is explored, as well as its use of structural equation modeling. There were over 51,000 adult participants between the ages of 18 and 85 that participated in the adult surveys. Of the sample, 3,053 participants are Asian Americans born outside the U.S. 1,058 participants were Chinese, 598 Korean, 534 Filipino, 416 South Asian, and 447 Vietnamese. 30,615 participants are U.S.-born non-Latino whites. The 2007 CHIS included 2 items that address health literacy. The first is, when you read the instructions on your prescription bottle, would you say it is very easy, somewhat easy, somewhat difficult, or very difficult to understand? The second item is, when you get your written information at a doctor's office, would you say that it is very easy, somewhat easy, somewhat difficult, or very difficult to understand? While we acknowledge that these questions may capture only one dimension of health literacy, they have been demonstrated to be valid proxies for health literacy by the Commonwealth Fund's 2006 Quality of Care Survey. Moving forward, we will be sharing the findings from this study. First, we want to remind you of the first hypothesis. The aggregated Asian immigrant group will have a lower level of health literacy than its non-Latino white counterpart. The heterogeneity amongst subgroups of Asian immigrants would lead to varying levels of health literacy. According to our findings, aggregated Asian American immigrants had lower level of health literacy compared to its non-Latino white counterpart. If you look at the graph, the groups circled in red all showed significantly lower levels of health literacy. Chinese with the lowest mean score of 6.00, followed by Vietnamese at 6.54, and then Korean with a mean score of 6.73. Moving on to the findings of our second hypothesis. Asian immigrants with a higher level of health literacy will have a higher level of self-rated health status and lower level of depressive symptoms than non-Latino whites. For the self-rated health status, we found that health literacy played a significant role in the aggregated Asian immigrant group. When disaggregated into 5 subgroups, health literacy was significantly associated with self-rated health status only in Chinese and Korean groups. As for depressive symptoms, health literacy was a significant factor for the aggregated Asian immigrant group. When it was disaggregated into 5 subgroups, health literacy was significantly related to depressive symptoms only in Korean and South Asian groups. To conclude, when aggregated, Asian immigrants have a lower health literacy level than that of non-Latino whites. Heterogeneity clearly exists in levels of health literacy across Asian immigrant subgroups. And health literacy is differently associated with health outcomes across Asian immigrant subgroups. Implication for social welfare practitioners include aggregated information on Asian immigrants may mask true health disparities that each subgroup faces. Findings from disaggregated data enable us to prioritize intervention efforts and give primary attention to the most vulnerable groups. The results suggest that it is important to study health literacy across disaggregated groups rather than across an aggregated group. That is, the significant determinants of health literacy and the significance of the relationship between health literacy and depression changed depending on the characteristics of the group the relationships were tested across. Some subgroups of Asian immigrant reported a lower level of health literacy compared to non-Latino white. Therefore, implications include a need to use plain language when talking to these immigrant parents, provide health information in their own languages, and a need to provide community-based health literacy education program to Asian communities. The study found that health literacy was a critical factor for health in some Asian immigrant groups. Thus, it is important for practitioners to use interpreters when delivering health and mental health information to Asian immigrant parents, particularly to those who report low education and low income level. Lastly, lower health literacy levels reported having higher depression scores for some Asian immigrant groups. Therefore, it is important for practitioners to provide education focused on mental health service utilization in these immigrant groups. As for some Asian groups, cultural factors could affect the expression or reporting of depressive symptoms. Thus, culturally competent / tailored health literacy education will improve depression in Asian immigrants. Thank you for listening to this module. We hope you were able to increase your knowledge about health literacy and the importance of examining health literacy levels among not only aggregated groups but disaggregated groups as well. Following this slide is Dr. Hee Young Lee's contact information.